Okay guys, I want to show you this foot today because this type of distortion is the worst type of distortion you can deal with a horse. Now there's lots of types of distortion out there and flares and things that we deal with as farriers, but whenever I have severe medial lateral distortion or distortion shooting off, especially to the medial side like this, I'm usually dealing with some sort of conformational defect. Dorsopalmar distortion, sometimes known as anterior posterior distortion, that's just growth. Sometimes we associate it with founder or clubfoot, but that's when like the toe gets too long or the heels get too long. But when this foot is diving under like that to the inside, usually I'm dealing with some sort of leg problem. It can't be solved with a shoe job or a trim job. All I'm going to be able to do today is help this horse with comfort a tiny bit. But unfortunately, this foot will be this horse's demise someday. The minute that he starts limping on it is probably when they need to start talking about putting this horse down. Okay, you can see on the bottom, lateral heel comes under really hard as medial gets away from him. This horse has a condition that I call, well not I call, that the industry calls fetlock varus. It's an angular limb deformity, starts at the fetlock and shoots to the medial side, and see it in the hoof. In today's trim, I'm going to try to get this frog right back in the middle of the foot. I'm going to take down this side as far as I can, get rid of the distortion on the medial side, try to give him a flat surface to stand on, but it's going to be tough. These are really tough, guys. Sometimes people think flare is just like flaring away from the hoof capsule, but this is flare also. It's just flaring underneath. There's a saying in hoof care that form follows function. And what that means is that the form of the hoof is going to follow the function of the horse. However this horse is functioning, and he's functioning on a crooked leg, and so the hoof is bending and compensating to support that crooked leg, but unfortunately it's causing broken and bent horn tubules in the foot that don't support the limb. These horses that have any sort of varus deformity are really hard to get under because their leg shoots in. It's hard for me to even properly get in a position to trim them. I know I can nip all this because it leaves a straight line from the hairline down. That coffin bone's rotated down like that, so I can confidently just nip through all of this because it's leaving that straight line that we like to see from the hairline to the ground. I just don't even have to really worry about hitting anything sensitive. What I'm referring to is that gap right there. I could probably take a nipper bite all the way into there, but I'm gonna just go a tiny bit more here, then do the rest with my rasp. Okay. All right, guys, this is all I could do today. If you want to get it from the front view, you'll see that I took off all the distortion I could, but the abnormal anatomy underneath remains. So this is what it looks like on the ground. Pick up this other part. I wish there was some sort of shoe I could put on, but there's just not enough foot. The underrun distortion on the lateral side is too severe. So we're just gonna leave it like this. This is all we can do for this horse today. Thanks, guys.